My name is Zoë Clark. I'm Senior Self Management Programme Officer at NASS. I'm also a healthcare professional and I have AS myself. So this evening's talk is Axial SpA in a nutshell, a brief overview of the condition. We'll have time at the end for Q&A, so please do pop any questions in the comments and I'll come back and answer as many as I can. For any specific questions about getting a diagnosis or your treatment, please do get in contact with our helpline, and I'll pop our helpline details in the comments at the end of the session as well. So let's get started. So firstly, what is axial SpA? So axial SpA is a type of inflammatory arthritis and it mainly affects the spine. The area where muscles attach to bones is called the emphysis. So in axial SpA, inflammation occurs here and we call this emphysitis. So you can get inflammation anywhere where the muscles and ligaments attach to the bones. The main areas that this affects are all the way along the spine, including the neck, the ribs where they attach to the back and to the front. And as you can see on this image in the blue at the base of the spine is the sacrum. And you can get inflammation where the sacrum joins the pelvis on each side. These two joints are called the sacroiliac joints, and lots of people with axial SpA experience inflammation here. For some people with axial SpA who have prolonged inflammation, the body tries to repair this area by laying down new bone, and over a long period of time, this can sometimes lead to joint fusing. This doesn't happen for everyone with axial SpA. Now, the terminology has changed a little bit in recent years, but it is still quite a mouthful. Axial Spondyloarthritis is known as Axial SpA for short, and this is the umbrella term. Some people are diagnosed with non-radiographic axial spondyloarthritis, and this means that they have symptoms of axial SpA, but when they have imaging done, there's no bone changes visible on an X-ray. They may or may not have inflammation shown on an MRI scan. Ankylosing spondylitis, known as AS for short, is the name that we use when someone has changes visible to the bones and they're seen on the X-ray. But not everyone with non-radiographic axial SpA progresses on to AS. There are many different symptoms of axial SpA and it affects every person differently, but the main symptoms are pain in joints and muscle stiffness, fatigue. This is an overwhelming feeling of exhaustion. It can be physical, but many people with axial SpA also experience mental fatigue, also known as brain fog. Importantly, with axial SpA, the symptoms can vary day to day or even hour to hour. As you can see from these photos of me, you may wake up one day and be able to go for a walk on the beach, whereas another day you might wake up and only be able to rest under a blanket, really restricted because of your pain and fatigue. So along with these daily variations, axial SpA is a condition that can cause flares, and a flare-up is a period of time where the symptoms are worse. Some people can track their symptoms over time and identify any triggers for these flare-ups and pace activities with rest to avoid overdoing it. But sometimes there can be no trigger at all and the flare will just occur out of the blue and really not keep us in. With many of these symptoms, they do tend to be worse with rest and better with movement. And this is a big difference to mechanical back pain or an injury, and is usually why people with axial SpA can have difficulty sleeping because of pain and stiffness. Now, axial SpA is not just back pain. Some people with axial SpA experience inflammation in other areas of the body. Extramusculoskeletal manifestations is the term that healthcare professionals use, and it means that the effects of axial SpA outside of the bones, muscles, and joints of the body. For example, around a quarter of people with axial SpA will have a condition called uveitis or iritis at some point in their life. This is where inflammation occurs in the front part of the eye, and it causes red, very painful eye that's sensitive to light and has blurred vision. It's treated with steroid eye drops, but it's vital that you see an eye doctor and ophthalmologist as soon as possible and to start treatment straight away after the symptoms start. Axial SpA is also linked with inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. And the symptoms of this can include diarrhea, stomach cramps, fatigue, loss of appetite, anemia, and bowel ulcers. It's important to discuss any of these symptoms with your doctor if you're experiencing them. As I described earlier, inflammation can occur anywhere where a tendon or a ligament attaches to a bone. Because of this, axial SpA can cause foot problems, such as Achilles tendonitis or plantar fasciitis. And this usually leads to swelling, pain, and joint stiffness. So if you're experiencing these symptoms, do mention them to your doctor, or you can also see a podiatrist for specialist advice. Around a tenth of people with axial SpA develop psoriasis, a condition that causes raised plaques on the skin that can be itchy, flaky, scaly, or red. The condition is not infectious, and some people can be unaware they have the condition, particularly if it affects areas such as the scalp or behind the ears. You can be referred to a dermatologist for specialist advice and further treatment. And we have lots of information about all these conditions on our website, and even have a free downloadable guide to uveitis. As these symptoms are all linked to inflammation, some medications that help axial SpA will also help these conditions. So it's another reason why it's important to make your rheumatologist aware if you're experiencing any of these symptoms. Now, some people refer to axial SpA as a rare condition, but it's not. It affects 1 in 200 adults in the UK. And despite the myth that axial SpA is a male condition, it actually affects the same number of females as males. It's a condition that tends to start when people are younger and often during formative stages of life, when someone might be trying to study, start a career, form relationships, or start a family. And the average age that it starts is 26 years of age. There is a genetic link, and 85 to 90% of people carry the HLA-B27 gene. However, it is possible to have axial SpA without this gene, and similarly, you can have the gene and never develop the condition. And despite it being a fairly common condition, a recent study by NASS found that 91% of the population have never heard of axial SpA. And unfortunately, it takes an average 8.5 years to be diagnosed, and I expect lots of people watching this may have waited much longer than that for theirs. In terms of treatment, axial SpA is managed with a combination of medication to reduce the inflammation, exercise to maintain and improve your mobility, and self-care techniques to manage different symptoms. There are 3 areas where medication can be helpful. The GP or rheumatologist can prescribe non-steroidal anti-inflammatory medications, also known as NSAIDs or anti-inflammatories. This includes ibuprofen, diclofenac, celecoxib, and atoracoxib. NSAIDs help to dampen down the inflammation that causes the pain, stiffness, and other issues. Biologic therapies are prescribed by rheumatologists and can be helpful if someone either doesn't feel the benefit from NSAIDs or they're experiencing side effects. Biologics aim to stop the body from producing the inflammation in the first place, and we have a free guide to biologic therapy available on the website. There are lots of pain medications that aim to manage your pain, allowing you to be more mobile and more active. So if you're struggling with your pain, it's worth speaking with your doctor to look at the different pain medications available. And exercise is really important as it can help improve and maintain your movement, reduce joint stiffness, help your posture, and it's good for your overall health. It works alongside any medication you're taking, and you can approach it in different ways. So personalised exercises from a physiotherapist can be really helpful to target any areas that you're particularly affected with. One-to-one physiotherapy can be really helpful if you're new to axial SpA, if you're switching medications, or if you're struggling to manage your symptoms. We also have branches around the UK where you can join groups and have physio-led exercises. Exercising in warm water is also known as aquatic physiotherapy or hydrotherapy, and this is particularly helpful if you find exercises activating your symptoms or you're building up your activity after a flare-up. And most importantly, find an exercise that you enjoy, because you'll need to be doing this regularly and sustaining it long term. Walking, swimming, and Pilates are really great exercises if you're unsure where to begin. And do consider things like exercise classes, walking groups, YouTube videos, getting your friends and family involved, all sorts. Different things work for different people, and as I said, you've got to enjoy it to be able to do it long term. Now, I have links at the end of the talk to lots of resources to help you manage your axial SpA, and I will also add them to the comments at the end of the live session as well. But in terms of self-care, firstly, if you're new to axial SpA, it's really important that you give yourself time to understand the condition, to learn how it affects you, and to allow time to gradually accept the condition. Managing flare-ups can be quite tricky, but there are lots of tools you can use, and over time you can create your own personal flare toolkit. This is somewhere you can go during a flare to access all the self-care tips and tricks to help you manage your axial SpA symptoms. And we've got a video that I'll link to in the comments explaining exactly how you can create that flare toolkit. You can also ask your doctor to make a referral to occupational therapy if you're struggling with things around the house or at work, because making these adaptations can help you do more with less pain and fatigue. Now, smoking makes axial SpA worse and can also reduce the effect of biologic therapy. So if you're a smoker, then do consider asking your doctor to refer you for support in reducing or quitting to help your axial SpA. And finally, building a community around you and hearing from other people in a similar situation can really help you cope and also give you that emotional support. So do consider joining online groups such as Facebook groups, joining the NASS members forum, or perhaps even your local branch. I'll put a link to the branch link in the comments at the end of the live, but if you don't have a local one, you can also join Bristol's online branch, and these sessions are open to anyone in the UK. Now, before the session, I asked people with axial SpA to share some images of themselves that they'd be happy for me to share today. So thank you for everyone for sharing these photos with me, because it really does show you that you can't tell from looking at someone whether they have axial SpA or not, and it also affects so many different people. So if anyone watching now would like to share their photos, please do pop them in the comments, either now or if you're on catch up, because it really shows that you're not alone. Now, I know from experience from talking to people with axial SpA every day that at times axial SpA is an invisible condition. You may not be able to tell someone has it by looking at them, and this can be helpful at times, but it does also bring its own difficulties. On the day when you're in lots of pain, sometimes the last thing you want to do is talk about it. So even if someone's using mobility aids or has posture changes from axial SpA, it's still difficult from looking at someone to tell how they're feeling. But this brings a challenge that for strangers on the street or for people who only see you on your good days, they may not really grasp the reality of how axial SpA affects you. And remember those stats that I said earlier, that although 1 in 200 people in the UK live with axial SpA, 91% of the population have never heard of it. This is why NASS works so hard to raise awareness of axial SpA and provide support to everyone with the condition. But while that awareness is growing, remember that there's a whole community of people out there who understand what you're going through, and NASS is here to support you every step of the way. As I said at the beginning, this really is axial SpA in a nutshell, and I hope it's helped you to understand more about the condition. Please do share with friends, family, colleagues, and employers to help them understand as well. And I've put some links here that I'll add to the comments at the end of the session in case they're helpful. So if you've been watching and thinking these symptoms sound familiar, do head to our symptom checker to see if you may have axial SpA, and you can get guidance on speaking to your GP if needed. The My AS My Life webpage is packed with information about different aspects of axial SpA and your life. And you can find your local branch, download free guides, and learn more about axial SpA on our website. So thanks so much everyone for listening, and I'd be happy to answer any questions you might have, so pop them in the comments, and don't forget to share your photos if you'd like to as well. I'll stop sharing my slides there, and I'll check on the comments, see if we've had any questions. Hi everyone, thank you for joining us. Hi Faye. See, we haven't had any questions so far. Hi Heather, hi Steve, thanks for joining. And Sharon, hi. Did any of those stats surprise people? I imagine if you live with axial SpA, you'll probably know and feel familiar that although we know that it's not a rare condition, lots of people do think that, and unfortunately there's not much of that awareness out there yet. Do let me know if you were surprised with those stats or if they're about right what you expected. And as I said, I'll pop the helpline details in the comments as well. So if you've been watching this and you'd like any more personalised advice or have someone to speak to, do give our helpline for as well. Well, no questions coming in, so it really will be a axial SpA in a nutshell with a brief session tonight. But hopefully then you're able to share it with friends and family and help them understand more about the condition that you live with, and yeah, connect with other people with the condition as well. Now, Steve's comments, new to AS and just gone through a flare-up. Sorry to hear that, Steve. We do have some resources on the website, particularly about flares. We've also got a booklet that you can download as well. So I'll pop, when I finish the live, I'll pop the link to those resources in the comments there so that you can access those. And Heather says, so Heather finds the stats about right, to be honest. Never heard of it until my dad got diagnosed with it. Absolutely, there are lots of people who, you know, they're diagnosed with this condition they've never heard of before, and it can be really confusing and scary time. So hopefully NASS has been helpful for supporting you through that. James was saying he's intolerant for the meds they've given him, so anything that is pregabalin, that can be really difficult. We also have a previous session all about the different medications that are available. So again, I'll link to those as well. That was with Colin Beaver, who's a specialist nurse, and he did a fantastic session with all different medications. So there may well be something there that hasn't been considered yet. Hi Lisa, thanks for joining. Yeah, James and Steve. So a flare toolkit is a really helpful thing you can create. It depends on sort of what works for you really. Some people choose to have a notebook where they write down all the things that they find helpful during a flare. That can be things like a heat pack or ice pack, TENS machines, different medications that your doctor prescribes that you can kind of escalate up to if you need to, if you're in lots of pain. Some people prefer to actually have a physical place where they put all of these things. They might have a particular drawer or cupboard or a shoebox somewhere where it's handy, so that if you have that flare up and you're not sure what to do to manage it, you've got that physical place that you can go to, and you have all those different tools that can help you. I always recommend as well speaking to your rheumatology team and seeing if they have a rheumatology helpline and understanding what they can help you with, so when you should call them. So in your flare toolkit, you can keep a record of the helpline number as well, so that if you try all the usual things that help during a flare and you're still struggling to manage it, you've got the right people that you can speak to then as well. Again, I'll share a link where I did a live session where I shared my flare toolkit and got everything out of my cupboard, put it in the box, and did a live unboxing of that. And then there will be a few things you've not tried before that can be really helpful. Thanks, Lara. Glad you enjoyed it. Got a question from John. John changed to plant-based protein drinks in one meal, and what a difference. Would you recommend a plant-based diet to help? So diet is always a really tricky thing for us to advise on, because there's so little research in the area. It is growing, and particularly in terms of looking at gut microbiome and inflammation. The research is growing, so hopefully at some point we'll be able to give more detailed guidance. What we usually say is that a nice, healthy, balanced diet can be really helpful. But if you are going to make changes to your diet, then do just speak to a doctor or to a nutritionist to make sure you're doing it in the right way, and you're not going to be leaving out any specific nutrients. But lots of people do find that diet changes help, and sometimes it's a matter of trial and error, just seeing what works for you. And we've got a comment from Jane. Jane says, can inflammation move around? I have issues with various areas all over my body now and again. It was my Achilles a month ago, and now it's my knees. Yeah, absolutely. So unfortunately with axial SpA, because it's an inflammatory condition, it can affect different areas of the body, and pretty much anywhere where a muscle or a ligament attaches onto a bone. So around the joints, in the spine, but also anywhere in the body, and particularly in the feet, as you've mentioned, the Achilles, you can get inflammation in these areas that can come and go, can move around. And some people with axial SpA also get other joint swelling, such as knees, hips, elbows, wrists, and so on. So definitely, if you are struggling with that, it's worth speaking to a rheumatologist, just making sure that the treatment you're on is the right course for that, to get the actual inflammation under control. Oh, that's great, Steve. And yeah, good luck with your first rheumatology appointment. I hope that's helpful. And we do also have resource and websites on preparing for appointments as well. So I'll link to that too, so it can give you an idea of just getting your thoughts together before an appointment to help you make the most of that time with the doctor. And Amanda's commented, she's been told to stop her biologic drug due to raised liver enzymes. Has anybody else had this? So please do share if you've had similar experiences there. But yeah, some people do find that they get side effects of the biologics and have to pause them or stop. But absolutely, this sort of thing, we definitely recommend speaking to the rheumatology team for that specialist advice, that personalised advice. Yeah, and James finds during a flare-up, his Crohn's and lupus flare-up at the same time, and absolutely that can really help as well. That can happen a lot as well, because it's that inflammation that can affect cruel areas of the body. And Faye's asking, any advice for a lady wanting to get pregnant would be amazing. We've just updated our pregnancy and family planning, or planning for family pages on the website. So I'll link to that, Faye, and hopefully that's all the information there. But as always with that, we'd always say to speak to your rheumatologist early on and to let them know that that's what you're hoping to do, so that you can have that conversation, particularly if you're on any medication. They can make sure it's the right medication for during conception and pregnancy, and also just getting a plan in place for during pregnancy, how you're going to manage your axial SpA as well, in terms of medication you can take and things like non-medication pain relief that you can do as well. And Anne-Marie has shared, I get a lot of pain in my lumbar spine where my ribs connect. It's more of a burning pain, but I'm yet to find anything that helps relieve the pain. Any tips much appreciated. I'm due to start biologics next month if my bloods come back clear. Yeah, so rib pain I think is a really tricky area to manage, and I do notice probably more women than men tend to experience this. So firstly, the biologics hopefully will help, because actually getting the inflammation under control should have a good effect on that. But we do have a live session again that I can link to. I'm sorry, I'm just going to put loads of links in the comments for everyone, but yeah, we've got a live session that focuses particularly on rib pain, mid back pain, and also low back pain as well. So I'll send that over, because hopefully there'll be some advice there that you can do in the meantime that will help with the pain and help get it under control. And Amanda's asked, should we tell the optician that we have AS? It's always worth telling them, your full medical history, particularly if you're on medication, just in case there are any potential side effects that can affect your eyes. Generally, it's only relevant in terms of if you develop symptoms of uveitis. We'd always recommend, if you do get symptoms of uveitis, usually if you Google online, you can find your local areas sort of helpline for eye conditions that's sort of either out of hours or a direct helpline. So you can either go to an optician or use the helpline, and they'll be able to then refer you to an ophthalmologist, which is an eye doctor, who can then diagnose it and then prescribe the treatment. So it can be helpful, just for them to be aware of, just in case you get any symptoms. Steve shared that having a fan helps to cool him down with the sort of burning low back pain. So it's good that helps, definitely. Wonderful. Well, I'm aware that we advertise the session as Axial SpA in a nutshell, so I don't want to keep everyone here too long, but I'm really glad you're all sharing your experiences in the comments, and I'll keep an eye on the comments over the next few days as well, and keep adding the resources there as well. Final question, James asks, does anyone have pain in the feet, like the heels, really sore when I get up in the morning, I can't walk for a good half hour to an hour? Yeah, so heel pain, that can be linked to either inflammation in the Achilles tendon, where that attaches just at the back of the heel, or it can be combined, to do with plantar fasciitis, which is inflammation of the connective tissue underneath the arch of the foot. Most people, when they have that, because it's inflammation, it tends to be worse when you've been resting, so particularly overnight. And then once you get moving, that then eases it again. So again, we've run some sessions particularly on foot pain. So I'll link to that, James, and hopefully I'll give you lots of tips on things like using ice locally, exercises you can do, and also when to see a podiatrist for more specialist advice as well. But do mention with your rheumatologist next time you see them that you're experiencing that, just so they're aware that the axial SpA is causing inflammation in that area. And James shared she's struggling with pain in both feet, and has tried foot spas, massage, TENS machines, and reflexology. Feels like both ankle joints are very tight. Ideas to help. So again, with that, I'll send over the video that we did with Lindsay Cherry, who's a podiatrist, because she went through some exercises that you could try as well. But also, if you do find that you're trying all those self-care techniques and they're not helping, definitely then do speak to either podiatrist or your rheumatologist. Yeah, and Faye shared that she gets similar thing with pain in the feet. It's something that I think we overlook quite often and don't realise that it's related to axial SpA, but lots of these things can be linked. Wonderful. So I'll give everyone a minute just for any last minute questions. But in the meantime, I'll let you know that our next live session is going to be next Wednesday, the 20th of July at 6 p.m. And I'll be joined by yoga teacher Jamie Boda. And Jamie is going to be running through a nice gentle yoga session that you can do from the comfort of your bed. So for anyone who finds it difficult getting down to the floor or back up again, or if you want to have some exercises that you can do to either loosen up in the morning before you get up, or to wind down in the evening, help you relax and go to sleep, then that will be a really great session. So do come and join us for that. But as always, like with this session, the video will stay on the page afterwards, and we'll also pop it onto our YouTube page and our website as well. So I hope that's been helpful, everyone. Thanks, Anne-Marie. Glad the chat at the end has been really helpful as well. Thanks, Ben, for joining. And yeah, as I said, thank you again to everyone who shared their photos in the run up to this session. It was really great to include all of you in this. And yeah, if you're watching on catch up, feel free to pop your photo in the comments as well. It's really nice just to see, you know, there's such a big community out there. So while we're raising awareness, we've got each other to support each other as well. And as I said, NASS are always here for you as well. So do get in contact with us if we can give any advice or support. So thank you, everyone, and hopefully see you next week for some comfy yoga from the nice comfort of your own bed. Take care, everyone.